Hey guys, so I'm gonna do a video that it's a surgery video. It's on Surgery Squad, and yeah, I've never done this before, but little warning: if you are if you're a child that doesn't like this stuff, or if you're squeamish as an adult, you may not want to watch this. But yeah, let's start. Virtual closed rhinoplasty.
Closed rhinoplasty surgery.
Right.
I'm Dr. Susie.
Susie.
Today we will be performing rhinoplasty. It's what's commonly referred to as a nose job. In this cosmetic surgery, our patient is a young lady who's looking to change the shape of her nose. We'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing.
Okay.
Some surgeons will perform this surgery using a local anesthetic and sedation, which makes the patient numb and in a dreamlike state. I prefer to work with the patient under general anesthesia and completely asleep.
Okay.
What we're doing today is reshaping the bridge of the nose. Our patient feels it's too wide and doesn't like the hump on it.
Right.
The thinning of the nose is called an infracture. I'll bet you can't guess what the widening of the nose is called. All right, I'll tell you. It's an outfracture. Some patients may also want the tip of the nose reshaped. That's called typoplasty. But as I was saying, this patient only wants an infracture and some reshaping. Easily done. To begin this procedure, we need to open the nostrils as wide as possible.
She was like a pig.
We do this with a retractor. Can you place the retractor in the patient's right nostril?
Oh yeah, just telling you, sorry if this is all like in a box, because
now with the nostril opened wide, we'll make an incision inside in a crescent moon shape.
Oh, God.
That will allow us to access the bones and cartilage that make up the nose structure. I've made the incision. Can you use the forceps to remove that portion of the nostril? Surgeons must be hyper-vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell.
All right.
To reshape the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome.
Oh, God.
We place the osteotome at the base of the hump and then carefully tap on it with a small rubber mallet.
What?
This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
Ooh, it makes me cringe. I'm just feeling really weird. Okay, crap.
Now that the hump is loosened, we need to pull the bone and cartilage out of the nose. Use the tweezer-like forceps to slip it out of the incision.
Oh, God. Well, at least you're asleep.
Now that the bump is out of there, we need to smooth the edges on both sides with a rasp.
Okay.
The space left by the bone we've removed is referred to as an open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them. Tap the osteotome once each time I reposition it on the left and right nostrils.
Oh, dude, that must... Imagine if you're awake.
Now that the bones are broken, I just take my fingers and reposition them to close the open roof. Because we made such perfect breaks, the bones slip right into place and the nose is perfect. A few stitches to close up the incisions, and then we place nasal airway splints in each nostril to hold things in place. Steri-strips go across the nose, and an external nasal splint is added to hold everything tight.
I'm cringing.
Our patient will have some bruising and minor pain for a few days. We'll remove the splints in about a week. Most of the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
Thanks, Susie. Oh, virtual Botox surgery or virtual root canal? Okay. Let's do Botox, even though it kills you. Never do Botox, people. Okay. Let's go again. That didn't work. Let's do the laparoscopic gastric bypass. Ooh, yeah, this is gonna be exciting. This is weird. Surgery squad.
Welcome to Surgery Squad's
Jeff.
virtual laparoscopic RNY gastric
No, it's
bypass
guys,
surgery.
Jeff.
I'm Dr. Jeff,
I'm Dr.
and I'll be
Jeff.
your guide for this procedure. Are you
All right.
ready?
Yep.
Let's scrub in. Gastric bypass surgery is designed to assist an obese patient in weight control.
All right.
In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine. There are several common types of gastric bypass surgeries. We've
Ooh, it makes me cringe. I'm like shaking and stuff. It's so. Ooh, it makes me cringe.
recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into
Excuse me? Skills like yours? Yeah. Yeah. Look at me like that. My skills, I'm the one doing the surgery, sucker.
shape in about 5 minutes.
5 minutes. Yeah.
Our patient has been prepared for the procedure with a mild sedative,
she doesn't
and
look
now
good.
the anesthesiologist places a mask over her nose and
She looks
mouth,
messed up.
and she'll drift off into dreamland. From here, we'll place an endotracheal tube down the patient's throat. You're up. See if you can get the tube into place. Great work. This tube is then connected to a respirator. The patient is ready to go. Now we can begin our laparoscopic procedure. The first thing we'll do is make 6 half-inch incisions in the abdomen. Slide the scalpel in where I have marked to make the incisions. Be careful. These are small incisions. Don't get carried away.
This looks horrible.
Nice technique. You must have an excellent teacher. Oh, wait. That's me. Next, we'll place a device called a
Jeff.
trocar into each incision.
A trocar. Jesus, a trocar.
These devices
I'm
allow
so
us to
messed up.
easily slide the instruments into the abdomen. Some of the instruments we'll use include a light and a camera, so we can see what we're doing on a video monitor, as well as the surgical instruments, such as the stapler.
He sounds so serious. As long as it's a surgical instrument, it's a stapler. What the heck?
Now, to give us plenty of room to work, we fill the abdomen with carbon dioxide.
What?
Let's face it, with the newbie helping out, we'll need all the room we can get.
Oh my god.
Time to
So-
start the gastric
I'm
bypass.
cringing.
We'll use this monitor here to
crap.
see our work.
Okay.
In RNY gastric bypass, we
All right.
eliminate up to 90% of the stomach by making the patient's stomach the size of an egg. We do this by first placing a
If
line
it's the size of an egg, couldn't you technically just eat one egg? For like... Wait, that's really weird. Dude, imagine the farts that you would let out with just a stomach the size of an egg. You couldn't even let out a fart. Imagine your turds. God, why am I like this?
of staples
2019
that
YouTube.
separate the smaller new stomach
All right.
from the whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation. Click the stapler where indicated to create the new stomach pouch.
Oh wow. That's actually satisfying. I like
We'll
that.
now separate the small intestine from the old stomach, about 2 feet down.
Okay.
The lower part of the intestine will be connected to the new, smaller stomach with a half-inch opening between the stomach and the intestine.
Alright.
It's kind of like rerouting traffic on the 405. Use the electrocautery device to create a half-inch opening where indicated in the new
I did not get that joke and I don't want to.
stomach pouch.
Oh. Okay.
Now, drag the loose end of the intestine to the new stomach pouch to attach it.
Wow. Wow. Who hired me?
I'll add some
Right.
sutures to hold it all in place. Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the
Jesus.
free
That was
end
the
of
worst
intestine
joke ever.
attached to the old stomach
Oh, okay.
over to the spot on the small intestine where indicated. Again,
There.
I'll suture it all into place. The new smaller stomach pouch was created. Everything has been reattached, and we checked for any leaks in the sutures.
Oh, gross.
This new configuration allows our patient to feel full sooner when eating, but also lets the fluids from their original stomach aid in the digestive process. I'll need you to remove each of the laparoscopic instruments and trocars.
Yeah.
Now we need to suture each of the incisions.
Check me out, bro. So fast.
Nice work. I bet
Nice
that won't
work.
even leave a scar. Now our
I
patient
don't know
goes
about
off
that.
to recovery. In most cases, they'll
Generic
spend a few
hospital.
days here in the hospital so we can monitor their progress.
I really have to
Afterward, our
pee.
patient will meet with her doctor and a nutritional specialist. They will assist her with her new lifestyle and eating habits. You've been a great help. Why not try another fantastic surgery at surgerysquad.com.
Okay, I think I know which one I'm going to do next. Alright, let me check something. Let's see if I can pause. Alright, now I actually have to go pee, like, really bad. Okay, I'll just be a second. I have to go pee. Okay, see you in a second. Hey. Okay, back. Hello? 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 Okay, yeah, we're good. Everything's working. I'm gonna do cataract eye surgery. Okay, let's go. Ooh, it's gonna be fun.
Hello, and welcome
Susie,
to Surgery
yeah,
Squad's
Susie.
Cataract Surgery. I'm Dr. Susie, and
I
I'll
don't,
be
I don't want to say I'm a civilized human, but I like her as a friend because she is helping me with these surgeries. Yeah. Am I any different from like my other videos I've done? Because I feel like in my other videos I'm like way more freaking in your face. I'm energetic and like I don't know. But maybe because I'm just tired. Because where I am, it's it's freaking, what time is it? 9:30 in the morning. Oh look! No, you can't see that. Sorry, okay. Yeah, so let's continue.
guiding you through this procedure today.
Alright.
A cataract is a clouding of the lens
I know.
inside the eye.
I don't know what cataract
The lens
is.
is located behind the pupil and focuses light on the retina.
Oh.
A cataract causes loss of vision that can't be corrected with glasses, contact lenses, or even LASIK, so it must be surgically removed. We're going to remove the clouded lens and replace it with a new one called an intraocular lens,
Okay.
or IOL. The surgery takes about an hour and can be done on an outpatient basis.
Right.
Today,
Oh my
our
god.
patient is a 66-year-old woman.
She looks like the last lady that did with the freaking laparoscopic gastric bypass. Look at her. She looks like she's older. She's 66. She looks weird though.
Who has noticed an increased blurriness in her vision, as well as decreased night vision. She saw her eye professional, and she detected cataracts and recommended her to us for surgery. Let's begin. First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put her to sleep.
I've seen other YouTubers do this. They always freak out from this. Let's see how bad it really is. It's bad. Oh yeah, I could hear it. I could see. Yeah, it's bad. Oh god, that's how I sound when you talk about.
Just prior to surgery, additional drops of anesthetic are applied.
This lady looks freaking dead. Look at her eyes. Okay, numbing drops, I guess.
We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please. We begin the surgery with a small, painless initial side port incision. This is called a limbo-corneal incision. It's done by making a small cut in the limbus with a crescent knife.
A crescent knife?
Next, we use the crescent knife to make a corneal tunnel into the anterior chamber of the eye.
Okay. What is it?
A thick, transparent viscoelastic fluid is injected to fill the space between the cataract and the delicate underside of the clear cornea in front of it. This is done to keep the cornea from collapsing during the procedure. Help me out and inject the fluid into our patient's eye.
Okay. Oh god, that was horrible. That was horrible.
Now we need to make a 2.85 millimeter wide incision at the edge of the cornea for the cataract removal. This is done with an extremely thin diamond scalpel.
Diamond scalpel? That's diamond. Okay.
A bent needle is inserted into the incision and used to poke a hole into the clear sac that holds the lens with the cataract.
Gross, gross, gross. No, don't
the
poke
needle is dragged to cut a line in the sac. With the incision made, we'll insert the forceps to grab the torn sac and tear a circle out of it.
Ew! What do you think this looks like when they just point that out? What do you think this looks like when you're actually getting this done? Because you're awake. Like, I wonder what it looks like.
Now you will need to inject fluid into the incision to separate the lens from the capsule.
Lens from the capsule.
This causes the lens capsule to float,
the frick is
so
that?
that it can be rotated during the next step.
Wait, what?
We'll now perform phacoemulsification, or phaco. This is done by using ultrasound to break up the affected lens so it can be removed from the eye. To do this, we pulse and drag the device to cut across the cataracted lens.
What is... Oh my god. What the frick was that? What do you think that looks like? That must look so weird when it's happening to you.
We repeat the phaco from the other direction to create 4 pieces.
Bizarre. Jesus, the frick is this? Wait, it only looks orange because our surgical lights are reflecting off the back of the retina.
Oh. Used to suction out the pieces of the old lens.
Oh my god, I'm so messed up.
I'll need you to remove the last remaining soft cataract material out of the eye, leaving behind the clear, empty lens capsule.
What the frick am I supposed to do? Drag the FACA device. What the frick was that noise? Oh, that's the grossest noise I've ever heard. Ugh, Jesus.
When you're done, inject more viscoelastic fluid into the lens capsule to keep it from collapsing.
Okay. It is messed up, man. Holy crap.
The flexible intraocular lens is rolled up for insertion by the assistant and placed in a soft tube.
I'm the assistant, dummy.
The IOL is now injected through a tube into the vacant lens capsule.
Oh, this is actually interesting. What the frick is that thing? Okay. Oh. Oh, it's
A probe
disgusting.
is used to spin the lens into place.
Wait, what? What do you think that looks like? Do you think it's just like spinning?
The
It
thick
looks like it
fluid
wasn't
we added
spinning?
to the eye will need to be removed, and any remaining
How?
microscopic cataract fragments should be rinsed out as well.
Uh,
The incisions in the eye are generally self-sealing. Very rarely that we need to add a suture to close the incision.
okay.
In our patient's case, we don't need any sutures.
Alright.
The lens is now in place. Our patient will need someone to drive her home after cataract surgery, and she shouldn't drive until she's cleared at her follow-up appointment tomorrow. We'll prescribe medicated eye drops to use several times each
I
day
hate eye
for a few
drops.
weeks after the cataract surgery. And she'll need to wear a protective eye shield while
Ooh,
sleeping
it's
or
nice.
napping for about a week after surgery.
That's
A
messed up.
special pair of post-op sunglasses
Holy
will
crap,
also need
those
to
are
be
things
worn
are
to protect her
nice.
eye from sunlight and other bright light as her eye recovers. You did a great job today, surgeon.
Yay!
While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
What the frick is this? I don't even know what that is. Let's do the tonsillectomy. Guess you're removing tonsils. I've never seen this one before or played this one, but it looks bizarre. Surgery Squad. Jeff.
Welcome to Surgery Squad's virtual tonsillectomy surgery. I'm Dr.
Tonsillectomy.
Jeff. Today we'll be removing a young man's tonsils. This is a common operation
The
that's
heck?
performed when a
It looks
patient
weird.
suffers from frequent bouts of tonsillitis. It's most often performed on younger patients, but adults can need it as well. The tonsils are located at the back of your throat on either side of the uvula. That's the little punching bag thingy that hangs down in the middle.
Punching.
Tonsils are infection fighters, but
when
occasionally
people call it
they
that.
lose the fight and get infected themselves. They become red and enlarged and can sometimes make it hard to breathe and swallow. Normally we treat this with antibiotics, but when tonsillitis reoccurs frequently, we remove them because the infection can cause more serious damage. Our patient was given a sedative before being brought into the operating room, and the anesthesiologist will help put him completely under.
Anesthesiologist.
Help me out and place a breathing tube in our patient's nose to assist with breathing while we operate.
Oh, God.
We need to get our patient's mouth open wide so we have room to work. To do that, we'll use a special mouth gag retractor that opens the mouth,
The frick
depresses
is
the
that?
tongue, and locks into position. Why don't you take a crack at that?
Jesus.
Great job.
Jeez, that looks like a freaking torture device that they have in like Dead Space or Wolfenstein.
That should give us plenty of
Okay.
room. Now we
Oh,
have to
gross.
reach in and grab the infected tonsil
Reach
with the
in?
tonsil forceps.
Oh, okay.
We need to pull it to the side to expose the connective tissue. Can you do that for me?
Yes, I'm here for a reason, Jeff.
Nicely done. With the tonsil extended out, we need to place this electrocautery device at the tonsil's base. The device uses high-frequency current. By
Shut up.
removing the tonsils this way, we
No, no,
reduce
no, no.
bleeding and allow the patient to heal faster.
That looks painful.
Now
Actually,
that the tonsil
wait,
has
hold
been
on.
cauterized, we reach in with a tonsil guillotine clamp. The
Guillotine
clamp severs the
clamp.
last of the connective tissue and allows us to remove the tonsil from the throat.
A guillotine.
Clamp the tonsil and pull it out, would you?
Oh.
We'll bring the electrocautery device back in here and apply it to any bleeding areas.
Yep. Cauterize that.
Because this part of the
burn
throat
you.
heals quickly, we won't need any stitches. Now we repeat our steps on the other side
Think
of the
this
throat.
hurts afterwards?
Extend the other tonsil with the tonsil forceps. Just like the other side, we'll cauterize this tonsil to release it while keeping
Shut up. Okay, crap.
And finally, we need to remove the tonsil.
Alright. Guillotine clamp.
And don't forget those bleeders.
Bleeders. They could just call them open veins. Yes, or bleed thing.
I'll clean out the mouth with some irrigation and suction, and then we're all done.
Ew, what the frick is that noise?
We'll send our patient to recovery for 8 to 10 hours, and more than likely, he'll be able to go home later today. Once he's sent home, our patient will be put on a course of antibiotics. He'll need to keep hydrated with cold water or sports drinks. And if he gets hungry, he can have cool, soft foods like fruit pops, gelatin, sherbet, pudding, and of course, ice cream. Getting a little hungry?
No.
Thanks for stopping by surgerysquad.com. While you're here, check out some of my other spectacular surgeries. They'll always stand the test of time, unlike my hairline.
Alright, listen, I have braces. But getting braces is not a surgery. It hurts. It hurts a little bit while they're putting it on, but it hurts a bit afterwards too, because like your teeth are sore because they're literally moving your teeth so they're really loose and sensitive. It hurts. But it's not a surgery. Okay, this may be the... Let's try the LASIK eye surgery. We didn't do this one yet. We did the cataract. Okay.
Welcome to Surgery Squad's
Welcome to
virtual
Surgery
LASIK
Squad.
eye surgery.
It's Susie.
I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today.
LASIK eye procedure.
LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses.
Okay.
LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light.
Okay.
By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her
What?
prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as
Look at her
possible,
face. It's
so we'll
sad.
use drops to numb the eye. Can you place a few drops into her eyes?
Do some more numbing drops.
Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean.
Okay.
Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide.
Alright.
So let's get that speculum over the eye. If the patient was allowed to blink, we might cut or burn the wrong area. At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap. Now we place a suction ring over the eye.
A suction ring.
The ring sucks the cornea upward, making it easier to cut.
That's weird.
The patient's vision will likely dim and blur while the suction ring is attached.
Alright.
For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
Oh no.
With the corneal flap cut, we remove the microkeratome and suction ring and then peel back the corneal flap to expose the middle part of the cornea.
Middle. Go on.
This is the part we'll reshape with a laser.
Me.
The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser, and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound, and you might notice a faint smell similar of burning hair.
Ew.
And that's it. Please fold the corneal flap back into the original position. making sure our ink guides match up.
Is it good?
Nicely done. While you were working, I went ahead and took care of the other eye. We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful. That's why we put a clear protective shield over each eye. This keeps the patient from bumping or rubbing her eyes. The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on surgerysquad.com.
Let me find another one. Alright, teeth cleaning is going to be the last one. Alright, so sad. We did the line up last day. Yeah, we did everything. Okay. Well, not everything. I'm going to skip the childbirth because that shows everything. And I don't want to go through everything. Okay, we're doing teeth cleaning. Is this really a surgery?
Welcome to Surgery Squad's virtual dental prophylaxis. I'm Dr. Jeff, and I'll be assisting you with this procedure today. Dental prophylaxis, commonly known as a teeth cleaning, is a critical procedure in which a dental hygienist not only removes plaque and tartar from your teeth, but they can also instruct and demonstrate proper oral hygiene care. It is recommended that everyone get their teeth cleaned at least once every 6 months.
Okay.
If you're at a higher risk for periodontal disease due to age, tobacco use, or medical conditions such as diabetes or HIV, it is recommended that you have your teeth cleaned more often.
HIV.
Our patient today hasn't had a teeth cleaning in nearly a year, so they're certainly due for one. Let's put on our gloves and get started. Before we begin, would you like to learn about some common myths and misconceptions regarding general oral health?
Sure, I guess. And why not?
Great. Click on the following statements to learn about that myth or misconception.
I mean, I really don't know if... Because I don't really know if people actually do brush their baby's teeth. I don't know, actually.
Even though temporary teeth are eventually replaced, it is still recommended that they are brushed and flossed daily. Daily brushing and flossing not only prevents cavities and tooth decay, but it also helps children establish good oral hygiene habits.
Hard bristle toothbrushes work better than soft bristle? I don't know. Probably not.
Most dentists and dental hygienists will recommend that you use a soft bristled toothbrush as they get your teeth clean without damaging your teeth and gums.
Okay.
Hard bristled toothbrushes can cause your gums to recede.
Okay. That's cool. Good idea to stop brushing or flossing if your gums begin to bleed. I feel like if your gums begin to bleed, I feel like that's why you need to brush them.
If your gums bleed when brushing or flossing your teeth, it's a sign that your gums aren't healthy. It's recommended that you see your dentist if you experience bleeding gums. Brushing and flossing every day, in combination with routine teeth cleanings, will keep your gums healthy and prevent future bleeding.
Yeah, knew it. Brushing alone is good to keep your teeth. What do you mean? Oh, yeah, I guess.
While brushing does help keep your teeth and gums healthy, it is recommended that you floss at least once a day as well. Flossing removes the tiny pieces of food and plaque trapped between your teeth that your toothbrush can't get to.
Right.
Recent studies have also shown that flossing reduces the risk of heart disease.
Heart disease? Pregnant women should avoid going to a dentist? I don't know.
While it's recommended that pregnant women avoid getting x-rays, they should not avoid going to the dentist. The dental health of a pregnant...
Shut up. Okay, good.
Let's get started. You'll need to measure the depth of the periodontal pockets around each tooth using a periodontal probe.
Okay,
the probe is inserted with light pressure between the tooth and gum.
Oh!
When the probe is inserted,
Jesus.
it will result in obscuring a section of the periodontal probe's tip. The first marking visible above the pocket indicates the measurement of the pocket depth. Measurements of 1, 2, or 3 millimeters generally signify that our patient's gums are in good health. But measurements of 4 millimeters or more indicate the presence of periodontal disease. Why don't you go ahead and use the probe to measure the depth of our patient's periodontal pockets? As you probe, I'll call out the measure. 3.
He seems good.
1.
He seems good.
2.
Seems good.
2.
Seems good.
1.
Seems good. Not
4.
good.
Great job. I'll take it from here. 3. 1. 2. Based on the measurements, our patient could stand to floss a bit more regularly, but other than that, it appears that their gums are in good health. Now we need to remove the dental plaque and tartar on both the surface and below the gum line using a scaler.
Click and drag the scaler to remove the plaque and tartar.
These choppers are looking great.
I didn't do it.
Next, we'll use our toothpaste to polish our patient's teeth. Toothpaste, known as prophylaxis paste to dentists, is a gritty substance that is applied using an angled attachment.
Yeah, every time I go to the dentist to put that stuff on, I always choose mint. I don't choose the bubblegum crap.
Inserted into our handpiece.
Right.
Which flavor of paste does our patient want?
What type is this? Green, because I guess that means mint.
Mint, my personal favorite.
Knew it. Yeah, me too. It's my personal favorite.
Wow, that's fresh smelling.
Oh,
now we'll use the water from our air water syringe to wash off the paste.
Okay, this time I'm actually going to do it. Ah. I guess I'm done. What the frick is that?
Don't forget the suction.
What the? That's bizarre. What is his face doing? My ears.
And finally, we'll need to floss the patient's teeth.
Oh my god, what type of fingers do I have? I'm not even a human or a superhuman. Oh, that was a weird noise. Oh, what the frick was that? Ew. Now I'm gonna move over to the... no.
Perfect.
What the frick
Your
is...
teeth haven't looked better. We all know that we need to regularly brush and floss to keep our teeth and gums healthy. But what else can we do? Get a new toothbrush or change the head of your electric toothbrush at least once every 3 months. Over time, your toothbrush collects bacteria, and the longer you hang on to it, the more bacteria you're putting into your mouth. Obviously, you want to avoid foods and drinks that are high in sugar, but you also want to make sure you're not leaving out those that are high in calcium, vitamin C, and vitamin D. Foods such as apples, celery, raw carrots, and even popcorn can also help clean your teeth.
Popcorn?
So if you can't brush after a meal, eat an apple.
Well, I have braces, so popcorn doesn't really clean my teeth. It kind of makes them a bit stuck. I mean, popcorn stuck.
Your teeth will thank you.
What?
Looking to keep your breath clean?
Oh, mouthwash?
Make sure you pick up the alcohol-free mouthwash.
Jesus.
Mouthwashes that contain alcohol can dry out the tissues in your mouth, causing them
Who the freak uses mouthwash?
to become more vulnerable to bacteria. By cleaning your tongue with a tongue scraper,
Oh my God.
you're eliminating
What is
plaque
that
and the
thing?
pesky bacteria that can cause bad breath.
Pesky.
As stated before, you should schedule a teeth cleaning at least once every 6 months. This not only helps keep your teeth and gums healthy, but your dental hygienist can help you reinforce good oral hygiene habits. These are just a few tips to help you maintain good dental health. Remember, keeping your
Bizarre.
teeth healthy is just as important as keeping the rest of you healthy. And that's a dental cleaning. Fantastic job! Let's see what else you can do on surgerysquad.com.
Okay, I said this was going to be the last one, but now that I see a virtual lumpectomy, learn about the process of removing a cancerous tumor, this is going to be the last one. I know that, okay? I swear on my butt. breast cancer awareness. I do not want to see that.
Welcome to Surgery Squad's virtual lumpectomy. I'm Dr. Susie, and
Oh,
I'll be
Susie.
assisting you with this procedure today. Breast cancer is a type of cancer that originates in the inner lining of the breast's milk ducts.
Wait, what did this say?
And with the exception...
It said cancer is... Wait a second, what did I just get myself into? Wait, hold on. Most common... Oh, yeah, this has doobies in it. Nope, never mind. I'm not going to do that one. Are these all doobie stuff? Hair transplant procedure. Do a hair transplant. Ooh, jeez. Surgery Squad. Susie.
Welcome to Surgery Squad's virtual hair transplant. I'm Dr. Susie, and I'll be assisting you with this surgery today.
Okay.
A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today, we'll be using the strip harvesting method to treat our patient's male pattern baldness.
He looks like he would be in
Strip
GTA
harvesting involves removing a small strip of
GTA
scalp
5.
from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection.
Shampoo.
I think you can handle that.
Yeah, take that. Oh, yeah, get it all up in your face. Like, oh, yeah, right there. Get it all in there. Get it all in there. Oh, God, that comes out really wrong. Boom. Bath time. Oh, God, so sad. Quick and drag the work up a good lather. Oh, yeah, take that, Secca. It'd burn your eyes all up. Yeah. Okay. Sorry, I think it just made your hair even uglier.
So fresh and clean. Thoroughly rinse the patient's hair, and we're ready to get started.
So freaking clean. Done.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Okay. I'm going to draw a face. There's a hairline, bruh.
That looks good to me.
Come on. Yes.
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area. Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
Got it. Kaboom.
Great job. Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Alright. Wait, what? Oh, God. Yep, this is definitely a surgery.
Great! He won't feel a thing. Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
Oh, it's already bleeding. Yay, that's so fun. Die. What? This is bizarre. Why am I playing this?
Next, we remove the piece of scalp from the donor site. Make sure you have a good grip.
Shut up, Susie. Oh my god!
Once removed, we'll prepare
ever.
the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Now what the frick was the point? That's gonna take like 8 years. Oh my god. But yeah, check this out. Check my skills out. See, stop looking at me like that, bro. I'm the skilled one here. Yay, so cool. Look at me, look at me, look at me, da boo ba shang bang, a rang dang 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 doo da rap da da ba.
Great, let's get to some dissecting.
Alright, wait, what? Okay.
The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others.
How is this legal?
Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
Ew. Follicles. No one calls it freaking follicles. Oh no, this is bizarre.
Nice job. This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
Shut up. I do. I really freaking do.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the...
A microblade? What the frick is a microblade? Oh my god, what the heck is that?
Perfect. Oh my God, with all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Yeah, I think it is getting messy. There.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
This is bizarre. Oh my god, this is so long. Yeah, give me. Pop it down.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
That was fun. Sorry that I did this for 50 minutes. But yeah, that one was pretty fun. So if you want to check it out, if you want to check out this website, play for yourself, it's surgersquad.com. Just look that up. Should pop up on your web browser. I don't know if you need it on PC or if you can do it on your mobile phone or a tablet. But whatever. So See you later, guys. Bye-bye.